Tonight, this is an emotional discussion, certainly for me, and we hope it is for you as well. Did you know Missouri is among the worst states in the U.S. for childbirth deaths? We rank 42nd with 32.6 deaths per 100,000 live births. That's according to the March of Dimes. Although there has been a decline in teen pregnancy, which is good news, there's been an increase in prenatal deaths among African Americans, especially in St. Louis. According to a report by Washington University, the Institute for Public Health, African American infants in St. Louis County are more than twice at risk to prenatal death than Caucasian infants. Now, there are several reasons for prenatal deaths among African Americans. We're going to find out more during this show. I'm Carol Daniel, and tonight on The Issues, we'll focus on prenatal deaths among African Americans in St. Louis. We've got an incredible panel of health professionals with us. That's all coming up on this episode of The Issues. Stay with us. Thanks for staying with us. Today's panel consists of people who will share reasons for prenatal deaths in African Americans in St. Louis. Not only reasons, but solutions. Before we get to our panel, we begin with a video of a courageous mother. She wants to share her story about how Affinia Healthcare helped her through her difficulties.
Hi, my name is Andrea Sander. I'm a patient at Affinia Healthcare. I am just so glad that community health centers like Affinia are around. I've been going to Affinia for about a little over 10 years, and I've had 3 successful babies with them. This is my latest one, Josiah, and they were just so helpful with the centering program, getting me prepared to have her, and the after also. I had a lot of health issues during my pregnancy, and they helped me out so much with keeping my blood pressure and things like that under control so that she could come out a healthy baby.
Since our beginning as the Holy Cross Dispensary in 1906 and through our years as Grace Hill Health Centers, we have not wavered from our commitment to meeting the needs of the most vulnerable and disenfranchised. These are the people whose incomes are below 100% of the federal poverty level, the homeless, those suffering from mental illness and depression, the addicted, uninsured pregnant women, and babies. More than 43,000 patients call Affinia Healthcare their healthcare home, utilizing services such as women's health, dentistry, behavioral health, pediatrics and internal medicine, chronic disease, and enabling services, just to name a few. In today's healthcare climate, the typical sources of funding fall short of sustaining the level of care that our community needs. Our federal grant sources make up only 20% of our budget. We must rely on other sources of support. Our role in addressing critical needs in the region is vital. The needs of our community may change over time, but high-quality health care is a constant and urgent necessity.
If we didn't have places like Affinia, there would be a lot of sick people walking around, I think, because they take such good care of their patients, and I just couldn't imagine not having them around. They're just so helpful with all the issues that I have personally, and my children have my first 2 children have some health issues also. I honestly don't know what we would do without them, honestly.
Our special thanks to Andrea for sharing her story. Now let's join our panel. They are here to help us better understand why there's an increase in prenatal deaths in African Americans, especially in St. Louis. So let me introduce this incredible panel tonight. Joining us first is nurse practitioner Sue Kendig. She's a women's health integration specialist with SSM Health St. Mary's Hospital in St. Louis. Next joining us, Dr. Kendra Holmes. She currently serves as Vice President, Chief Operating Officer for Afinia Healthcare, formerly Grace Hill Health Centers. And Dr. F. Sessions Cole, Vice Chair of the March of Dimes National Board of Trustees and Assistant Vice Chancellor for Children's Health. Thank you all for joining us tonight. This is going to be an incredible conversation. We've already had about 20 different conversations about this issue because it is so important. What we want to find out, though, and try to determine is, why is this happening in St. Louis, especially in St. Louis? Sue, why are so many African-American women losing their children in childbirth?
Well, there are a variety of factors that could play a part in that. As you said, generally that we see those statistics be at about 2 to 3 to 1, where black babies are dying either during the pregnancy or within the first year of life. So looking at medical factors, certainly risk factors that may appear during the pregnancy, the state of health that a woman enters pregnancy with may play a role. But we also know that there are systemic and structural factors that can play a role outside of healthcare that may be affecting black families and black women differently in terms of the stressors that are involved when they experience structural factors, certain social determinants of health and so forth, that may influence how their bodies react to that stress over time, and that can play out during the pregnancy.
A word we use is poverty quite often, Dr. Holmes. First, how did you help Andrea?
So Andrea's story, unfortunately, is similar to a lot of our patients. These individuals have come into our health center and they do live in impoverished areas. They lack resources and they lack often the skills to navigate the healthcare system. The healthcare system can be difficult for individuals who do have resources. So what we do at Afinia Healthcare is that we really meet our community where they are. So we have a tremendous amount of outreach to our patients. Our providers are exceptional. We develop trust with our patients, and that's key. Trust is key to any healthcare relationship, but especially for moms who have been traumatized and are in these situations where poverty really impacts their health. It's important for our providers to feel as though they can communicate with the patients can communicate with them. So there's a lot of trust building, and I just want to really emphasize that that is key, because when you feel that your provider has your best interest at heart, you follow their recommendations.
Poverty is everywhere, though. So why St. Louis? Why are women in St. Louis, especially black women, not having successful, healthy pregnancies? Poverty is everywhere. What makes it different in St. Louis?
So poverty is definitely everywhere, but in St. Louis, we have some very dense pockets of poverty. If you look at as far as life expectancy, the life expectancy for individuals in North City compared to areas such as Clayton and more affluent areas, there's in some areas an 18-year difference in life expectancy. So while there is poverty everywhere, St. Louis is an area where poverty really impacts not only your health, but your life. And that really goes back also to systemic issues with our healthcare system that we really need to look at in St. Louis.
Dr. Cole, the March of Dimes has been around as long as many of us can remember, working on the issue of prenatal health care and healthy births. But for black women, maybe that message is not getting through. Why are black women suffering in such a way that we rank nationally in this disparity?
Black women are clearly at a disadvantage in St. Louis, and we don't understand all the reasons. There are many reasons that involve stress and are associated with poverty. There are many reasons that involve trust, because black women sometimes don't feel that they can actually go to a healthcare provider, just not like Afinia, but go to other healthcare providers and really get answers and feel respected. It's very important for healthcare providers throughout St. Louis to start with the assumption that every woman loves her fetus and every woman loves her baby. And if we start with that assumption, we go to a place where we respect and acknowledge the stresses that these women have to deal with. These women have to deal with stresses that most providers and many people in the healthcare system haven't ever experienced themselves. And so it's very important that we have established community partnerships that help us understand what women need to be healthy, not only during pregnancy, which is clearly very important, but also before and after pregnancy. The healthier a woman is, the healthier her pregnancy is going to be, and the healthier her baby is going to be.
Are we talking about racism in the health field? Because when you say, Dr. Cole, we have to begin with the assumption that every woman cares about her fetus. That tells me that there is the assumption and the stereotype that black women don't care.
Correct. I'm afraid that there is unconscious bias, also called racism, embedded in every healthcare system. I think there are now intentional efforts in most healthcare systems, and in certainly the medical schools in St. Louis, to begin to address intentionally the issue of unconscious bias. Unconscious bias is certainly a major problem for African American women, but it's also a problem for many other women, rural women, women who are not black but who are impoverished, women who may have had some behavioral mistakes in the past where they have tried illicit drugs. Just because a woman has tried illicit drugs doesn't mean she doesn't love her baby.
And doesn't deserve respect and the best health care.
And the best possible health care. And so that is the kind of initiative that I think the healthcare systems are beginning to try to develop. It will take time. These embedded unconscious biases among providers are not going to go away in a week or after a single course or after a single lecture. But I am optimistic that there is an intentional commitment to persist among the providers and among institutions that employ providers to try to address this issue.
Sue, clearly, and I know you're chomping at the bit, aren't you?
I am.
Go ahead, Sue, go ahead.
I think there's a point that we need to clarify here, because we've been talking a lot about poverty and we've been talking about people who perhaps don't have as many resources. But we also know that a black woman who is college educated is more likely to have a poor pregnancy outcome than a white woman who is not college educated living in poverty. So there is more to this than simply some of the structural determinants in poverty that we're talking about, and there's more to it than simply implicit biases. When we talk about racism within the healthcare system, that doesn't magically happen when a woman walks into a healthcare provider office or into a hospital. So to be part of this, to really start understanding why black women are affected, it's important for healthcare providers, healthcare organizations to really embed in the community, to walk in that community, to hear the voices in the community and understand the types of structural issues and structural racism that has been affecting the St. Louis area that bleeds over into the healthcare systems.
Because although we're talking about healthcare, and I'm college educated, and I had experiences that I won't necessarily get into tonight that left me with a bitter taste in my mouth while I was pregnant, but a woman who works, and most black women do, if her job is not allowing her to take a break, if her job is not allowing her to change her hours, that's a part of the structural racism that black women are facing as well.
Absolutely. Or women who are working, but they don't have time off. So when they leave work, right, they're essentially losing money, which may be very important to their family in keeping their home and so on, putting food on the table. So there are a lot of things to think about that aren't necessarily happening within the walls of that healthcare system that we as healthcare providers need to understand in our community and work to figure out how to help address that.
And we're going to take a break, but a quick question for you, Dr. Holmes. Do the women who come in to you, does your staff find that they come in thinking that I'm not going to get, and that's a part of the issue, I'm not going to get quality health care, I'm not going to get the attention that maybe I deserve? They might not even think they deserve it because they've been under such stress.
Well, Affinia Healthcare has been in the community for over 100 years. So what I can say is that the providers and the staff that are there, we are mission driven. So we listen to the voice of the patient, and the patients know that we're on their side. So that's one reason why we're able to have better outcomes than some other organizations, because we've been in the community, we are culturally competent, and that really helps with our patient outcomes.
All right, we are going to talk about solutions because we've already talked about some of the causes of why prenatal deaths are occurring among African American women. So when we come back, we're going to share what needs to be done. And let me say this to you, men, you are not off the hook. More next.
Doctors hoped I'd be fine.
Everyone said we'd be fine.
We told ourselves things were fine.
All we heard was, it'll be fine.
I thought my granddaughter would be fine.
I want my sister to be fine.
We know it's not fine, but with your help, it can be. Join the fight for healthy moms and strong babies.
We here at STL TV want to connect with you as we bring up-to-date information going on in your city. Whether it's events with the mayor, sports, music, and even spotlights on regional organizations, we're here to bring you the 411. You can keep current with STL TV and its shows by following us on Facebook at STL TV and both Twitter and Instagram at STL TV channel. What are you waiting for, St. Louis? Get connected and in the know today.
Welcome back. In case you're just joining us, today's topic is a critical issue that we're facing in our region, prenatal deaths among African Americans in the city of St. Louis. Now, our panel has shared information on how the impact is caused. Now we'd like to talk about some solutions, some ideas, as well as what is being done right now. So let's start with Dr. Cole. What's being done right now to solve this issue? You said earlier it's not going to happen overnight. What is being done right now from your standpoint?
The March of Dimes has long advocated centering pregnancy groups. These are groups of pregnant women who come together to talk with one another, advise one another, and support one another. This may seem like a pretty low-tech intervention, but this kind of support among pregnant women has been shown to improve pregnancy outcome, reduce risk of adverse outcome, and reduce risk of death among prenatal, among mothers, and among fetuses. So it's very important that women support one another during pregnancy.
Is that something that the March of Dimes has been able to, if you will, infiltrate into the city of St. Louis, into those, as Dr. Holmes put it, those pockets of extreme poverty?
Well, I think the March of Dimes has been leading efforts to document from a research standpoint the effectiveness of this, and then Affinia Healthcare has been a poster child for implementing the importance of that research.
Dr. Holmes?
We are definitely
You're on
the
a poster
child.
somewhere.
We are definitely the poster child for centering pregnancy, and what we've seen is that it works.
And describe centering pregnancy.
So a centering pregnancy is basically, it's peer supported prenatal care.
Okay.
So individuals are grouped with individuals who have due dates similar to theirs.
Oh.
They're able to talk about issues and health concerns in a group setting. It's very supportive. It encourages dialogue, not only with their peers, but also with their providers. It's just an area where individuals feel comfortable and trusted.
Can I just say that when I was pregnant, the first pregnancy anyway, that I was the only woman in my workplace that was pregnant. And I can understand centering pregnancy because there were so many times that I felt alone. I didn't know what I was doing. I didn't have anyone to talk to about it. There were a couple of women who were older, and I would talk to them. But that feeling of loneliness in your pregnancy is not something you ever want to feel.
Absolutely. And the support we find, individuals are more likely to keep their appointments. And access to prenatal care is definitely a barrier for some individuals. So we want to make sure that they take their appointments seriously, they make those appointments, because in the end, that's going to result in them having a healthy child.
All right, we're going to go to Sue, but don't forget I said, men, you are not off the hook. We're going to talk about that in just a second. Sue, what's being done now to turn this around and to save lives? Because that's what we're talking about.
Absolutely. And, you know, I think the centering discussion is a really good example. And I just want to note that there is actually a collaborative study being done here in St. Louis at, I believe, 9 different sites that include hospital sites as well as some of the other federally qualified health centers like Affinia. SSM Health has a centering site at St. Mary's that's participating in that. So we're looking at different things that help to support centering, such as the inclusion of mental health screenings, because we don't talk about mental health a lot during pregnancy and the postpartum period, but many women may be affected not only by baby blues, but by postpartum, prenatal and postpartum depression and anxiety. So really developing mechanisms to be assessing for broader issues in pregnancy that may impact the pregnancy outcome. The other thing that is really important for us to think about, and there is more attention being paid to women's health before she becomes pregnant and between pregnancies, because healthy women are healthy mothers, and healthy mothers are more likely to have a healthy baby. So taking care of yourself before you get pregnant and in between pregnancies is really, really important in order to have a healthy pregnancy.
Shout it out loud, women, okay? Say it. I need to be healthy before I even become pregnant.
Absolutely.
Period.
Women are important too.
Okay. Dr. Cole is the one who says, men, you are not off the hook. We're talking about solutions to address the really dramatic and drastic loss of life in St. Louis. African American women who are not able to have healthy pregnancies, we are ranking nationally in that arena, babies who are dying in St. Louis. Why do you bring men into this discussion? I mean, clearly, we understand what the role men play, but why, Dr. Cole?
The March of Dimes has long encouraged both men and women to plan ahead for pregnancy. Women understand, as Sue and Kendra have described, how important it is for them to be healthy as they can be. Men also need to plan ahead for pregnancy. If they are thinking about pregnancy, then men need to be sure they understand that their sperm, which will be half of the critical component of conception, needs to be healthy. Sperm are very sensitive to many environmental influences and toxins, from tobacco to alcohol.
Smoking. Stop drinking so much.
No illicit drugs.
Stop doing drugs.
Pesticides. If I were working in a garage and had organic solvent treatment or exposure, on a regular basis, I would consider how to avoid that if I were a man and thinking about getting pregnant. If I were a man and I'm on medication that might influence how my sperm perform or what DNA my sperm bring into the conception, I would definitely get some advice about how to take different medicines and not endanger the pregnancy by continuing those kinds of medicines. So,
what's the more difficult uphill battle we're facing here? Telling men and women to plan, or telling men to take better care of your sperm?
I think men need to understand that they need to be as healthy as they can be to take care of their sperm, because if their sperm are healthy, there's a much better chance of having a good pregnancy outcome. If their sperm are not healthy, then there's a considerable risk of an adverse pregnancy outcome. So men need to understand their accountability for bad pregnancy outcomes and plan ahead.
As women, and I've had 2 miscarriages, as a woman, you think that, I still wonder what I did or what I didn't do. But we don't talk about the role that sperm may have played.
Correct. And sperm contribute to adverse pregnancy outcomes. Unfortunately, because women carry the baby, women take the rap.
Right.
But
we're here tonight to end that.
In fact, men need to be accountable for being sure that they help optimize good pregnancy outcomes throughout the sort of reproductive age range.
So the other issue that our panelists really wanted to discuss is trust. What role does trust or the lack thereof play, Sue, in this terrible outcome of pregnancies in African American women in St. Louis?
There is no health equity without trust. And
wait a minute. There is no health equity without trust.
Yes.
Okay.
We talk about equitable health outcomes where there are zero disparities. The only way to get that is to develop an environment where women feel that they can come to their healthcare provider or to a healthcare system and be able to talk about some of these really hard issues, be able to tell their healthcare provider what they're concerned about. Maybe they have been smoking, maybe they have used illicit drugs, maybe they have a medical condition that they're concerned about, but for whatever reason, maybe they're depressed, but they don't feel comfortable broaching that subject with their healthcare provider.
They don't trust.
Exactly. So establishing that trusting relationship and understanding that in many places you have a team of healthcare providers. So even if they are not seeing the same provider at each appointment, there are members of that team that are consistent, usually the nurses. And it's important to have those relationships, someone that they can call, they can talk to and ask. And if you are feeling that you don't have the type of relationship where you can really ask sensitive questions of your healthcare provider, trust that they're going to get back to you, trust that they have your best interest at heart, as Dr. Holmes had said earlier, keep talking until you find someone who you feel that trust with. It's extremely important.
At Affinia, you pride yourself on trust.
Absolutely.
Why?
Well, I think we understand that there is justification for African Americans to distrust the healthcare system. There's been no time in American history where African Americans have received the same health care as Caucasians. So
no time.
There has been no time in American history.
No time.
Absolutely none. And we're aware of that. So we know our weaknesses, we know our strengths. And again, I just want to say that we have a team of medical providers, such as other organizations as well, who are committed to health equity. We're committed to decreasing health disparities. We're mission driven. Our providers are in these communities because they choose to be in these communities. They could be anywhere because they are that outstanding, but they choose to dedicate their life's work to these communities. And that shows, and our patients see it, and that's why we're so successful.
Dr. Cole, we only have a minute left. I do apologize.
I would say it's very important for providers to start with committing themselves to identifying the strengths of every pregnant woman and every pregnant woman's family and building on those strengths. It's very easy to be a social voyeur and take a woman apart because of some unfortunate behavioral issues in the past. Every woman and every family have strengths. It's up to us to find them and build on them.
I am about to cry at that notion. That is so touching to me. And I pray that people are hearing that from you, Dr. Cole, Dr. Holmes, Sue, and are moved to take control of your health, to believe that you deserve the kind of health care that others get, and that, in fact, it's available here in our St. Louis region. As Sue said, you just keep on going until you find that healthcare provider who will, in fact, listen to you. Thank you all. We could go on for another 2 hours, I know. Thank you for the work that you're doing. And like I said earlier, thank you for saving lives, because that is what we are talking about on the issues. I want to thank again all of our guests for sharing such incredible information with us on the issues. Thanks to each and every one of you who tune in to the issues and you share your comments. And we want to remind everyone that you can join the discussion as well. Be sure to check us out online. Of course, we're on Facebook, YouTube, Twitter, Instagram. We are everywhere. And don't forget to download the free, yes, I said it, free STL TV app. You don't want to miss our next edition of The Issues. We're going to lighten it up a bit. I think so. We're going to discuss aging in the city, how to live a vibrant life. If you're like me, in your 50s or in your 60s, how are you doing it? You're going to tune in for a great edition of The Issues. That does it for this episode of The Issues, but keep it right here on STL TV and Experience St. Louis.